has been researching your milk for hundreds of millions of years. The composition of your milk is alive and changes throughout the day, the night, the months, and the years to meet your child's needs. Your milk contains stem cells. These are cells that create and repair the body and are being researched worldwide to cure conditions like Alzheimer's and diabetes. Your milk contains components that kill cancerous cells. Your body identifies bacteria and viruses found in your baby's body and environment. You then produce antibodies specifically tailored to those infections and deliver them to your child through your milk. Your milk appears to switch on a gene in your baby's body, which produces a hormone called leptin. This hormone tells your baby when his tummy is full, protecting him against overeating. Your milk contains oxytocin, a hormone that induces relaxation and feelings of well-being in your child and in you. It's all in you. Human milk, tailor-made for tiny humans.
After delivering your baby, you'll be transferred to the postnatal ward, where we will care for you and your baby. The staff will check you and your baby into the ward. They will orientate you through your space, show you the call bell, bathroom and shower room, and complete checks on both you and your baby. The expected length of stay is dependent on what kind of delivery you had, and whether this is your first baby. There are lots of factors which may influence your length of stay, so this should only be considered as a guide. Following the delivery of your first baby, it is usual that you would stay on the postnatal ward for 2 nights to gain confidence with baby care and to ensure baby is feeding well. If this is not your first baby and you had a vaginal delivery, after 24 hours, if there are no concerns, you may be discharged home. Following a caesarean delivery, your length of stay will be longer. Discharge usually happens on day 3, when your pain is well controlled and there are no other concerns. The postnatal period is a time for you to recover and learn how to feed your baby and care for your baby. The staff in postnatal will assist you during this time.
My name is Danielle and I'm one of the clinical midwife managers here over in Parent Education. I'm going to talk to you about the importance of sterilising equipment. Your baby's immune system is not as well developed as in adults. Babies can become very ill if they drink milk that was contaminated with bacteria. Sterilising helps kill the majority of bacteria and so protects your baby against illnesses, in particular diarrhea and vomiting. For this reason, we recommend that all equipment used for collecting, storing and feeding babies under 12 months is sterilised before use. Before you begin, wash your hands. Start with discarding any unused milk, then use soapy water and a bottle brush to remove any milk residue. You can then clean out the teat and rinse everything well. Prepare your steriliser according to the manufacturer's instructions. Load your bottles upside down and your teats upright. Also include any items used to handle clean feeding equipment such as tongs. Switch on your steriliser and leave for the recommended amount of time. Once the cycle is finished, leave it for at least 5 minutes to let it cool. Wash and dry your hands again before removing the equipment from the steriliser with your tongs. Do not rinse your bottles after they are sterilised. When they are put together correctly, sterile bottles with tight fitting caps or sealing discs will be sterile for 24 hours, but only if you keep them closed. We recommend that you descale your steriliser every 4 weeks, unless you live in an area with hard water, and in this case, descaling will be required more frequently.
I'm going to show you how to bath your baby. Bath time is a chance for you to bond with your baby, have fun and play. A bath 2 or 3 times a week is enough to keep your baby clean. Firstly, make sure the room is warm, that you've gathered all the bits that you need: fresh clothes, towels, cotton wool and a clean nappy. Fill the bath, the basin or the baby bath or the sink between 8 and 10 centimetres of water. The water should be just high enough to cover the baby's tummy. Make sure the water is the right temperature, roughly around 36 degrees. Use your elbow to test the water. If it's too hot for your elbow, it's too hot for the baby. Undress your baby, but leave it in the nappy. Wrap it in a towel and place it in a rugby hold over your hip. Bring to the bath and use cotton balls to clean and wipe one eye at a time. Wash the face and wash the hair. We don't use anything other than water for this. Bring the baby back, dry it off, dry its head, get it underneath the creases. Then you can remove the nappy. Place your arm underneath the baby's shoulders and head, locking your wrist around the baby's arm. Lift the baby with your arm underneath the bottom, bring to the bath and lower slowly into the bath so that the baby doesn't feel like it's falling. When the baby's bottom is resting on the bottom of the bath or the basin, you can remove your hand and use that hand to wash the baby. After you've bathed the baby with your free arm, you can lift the baby back out, placing your free hand underneath the baby's bottom, holding its legs, because they are very slippy at this time. Place back on the towel, pat them dry. Don't forget to get underneath the skin folds and creases. Redress your baby with fresh nappy and empty your bath water.
Hello, my name is Caroline Harrigan and I'm a pelvic physiotherapist. I'm going to talk you through how to carry out your C-section massage. Within the first few weeks, the most important thing is to let your body heal and get it back to normal movement in and around your C-section scar by standing up tall, taking big belly breaths and doing gentle pelvic tilts forward and back. When your wound is healed between 6 and 8 weeks, you can start to massage around onto the C-section scar depending on how you feel when you touch it. To carry out your C-section massage, use a cream or oil, non-perfumed. Begin in a comfortable position and lying on your back with your knees bent, well supported with pillows. Using 2 fingers, gently touch above and below the scar to see how it feels before moving directly onto the C-section scar itself. Then carry out massage in 3 different directions for 1 minute. In circles, up and down and over and back. The edges of the scar may take longer to heal, as that is where they carry out the double knot and this area might feel a bit stiff and tight. If you feel the area is very sensitive, only use light pressure and get the area used to being touched by different textures, like rubbing cotton wool over the scar and a towel to help desensitize the scar. If you feel from carrying out advice and you're not healing and have issues with pain or any issues with the scar, please contact a health professional who can refer onwards to get you assessed if you are worried.
Hi, my name is Geraldine. Having a baby is one of the most important, joyful and exciting times for women. It is also a tumultuous time. Parenthood is a time of change, adjustment and transition. Your body, mind and emotions are on a roller coaster ride. It is expected and natural that many mums experience mood changes. Most new mums experience baby blues. This occurs in the first 2 to 3 days after birth. Baby blues commonly include mood swings, crying spells, anxiety, difficulty sleeping, and they may last off and on up to 2 weeks after childbirth. Other mums experience a more severe, longer lasting form of depression known as postpartum depression. If your symptoms continue for more than 2 weeks to a month, then maybe you are experiencing postnatal depression. Bad days are normal, bad weeks are not. Many women do not realise that they have postpartum depression because it can occur gradually. If you have postpartum depression, treatment is so important. Prompt treatment can help manage your symptoms and help you connect with your baby. It is also important to seek help as soon as possible to ensure that you and your baby get off to the right start together. A range of help and support is available, including talking therapy. Depression is like any other illness. It's not your fault you're depressed. It can happen to anyone. Being depressed does not make you a bad parent. Postnatal depression can start at any time in that first year after birth. Signs and symptoms include a persistent feeling of sadness and low mood, lack of enjoyment and loss of interest in things you normally enjoyed, lack of energy and feeling tired all the time, trouble sleeping at night, feeling tired during the day, finding it difficult to look after yourself and baby, and often withdrawing from contact with people who are important to you. Concentration becomes a problem and some people experience intrusive thoughts. Seek help. Talk to your GP, practice nurse, midwife specialist, postnatal public health nurse.